It's pretty amazing when you think about it. How can a surgeon in Tokyo read a medical report from a doctor in Toronto and know exactly what they're talking about? Well, it's not magic. It's a shared language. And today, we're going to decode that secret language of the human body, a universal system that lets medical pros talk to each other with perfect crystal clarity.
So let's just dive right in with the big problem. Think about it. If I say there's an issue above your knee, what does that even mean? I mean, if you're standing up, that's one spot. But what if you're sitting down or lying on your side? The location of above changes, right? And in medicine, that kind of confusion isn't just a small problem. It can be downright dangerous.
So, to get around this whole mess, science came up with a brilliant solution, a universal standard, a single fixed frame of reference that works no matter what position the body is in. It doesn't matter if you're doing a handstand or running a marathon, this is the bedrock for how we talk about anatomy. And where do we start? Well, that foundation begins with the standard pose. We absolutely need a universal starting point, like a factory default setting for the human body that everyone on the entire planet agrees on.
And here it is, the anatomical position. Okay, if you only learn one thing today, please make it this. This is the single most important reference point in all of anatomy. Seriously, every other term we're going to talk about is built on the idea that the body is in this exact pose.
So take a good look at this image. Every little detail here is on purpose. The person is standing up straight, looking right ahead. Their feet are flat on the floor, parallel to each other. But here's the detail that always trips people up. Look at the arms. They're hanging at the sides, but the palms are facing forward. Every single one of these details is absolutely crucial.
Let's just break it down into 4 super simple rules. 1. The body is erect. That just means standing up straight. 2. The face is looking forward. Easy enough. 3. The feet are parallel and flat on the floor. And 4. This is the one everyone forgets. Arms are at the sides with the palms turned forward. This last one is so key for defining what's what in the forearms and hands.
So here's your first big exam tip. Get your highlighters out for this one. These 4 rules, they are completely non-negotiable. If you're studying anatomy, you have to know these by heart. They are the foundation, the starting block for everything else you're going to learn.
All right, so now we've got our standard position locked in. Let's add the next layer to our map, imaginary planes. The best way to think about these is like invisible sheets of glass that can pass right through the body, dividing it up into different sections. These planes give us our first real 3D map to work with. First up is what we call the coronal plane, sometimes called the frontal plane. This is a vertical slice that runs from side to side, basically dividing the body into a front half and a back half. Imagine it's what separates your nose and your chest from your shoulder blades and the back of your head. And you can see it perfectly right here. See that blue plane? Everything in front of that blue slice is what we call anterior, and everything behind it is posterior. And just like that, we've made our first official cut. Next up, we have the sagittal plane. Now, this one is also a vertical slice, but it runs from front to back, dividing the body into right and left pieces. And there's a really special version called the median sagittal plane, which cuts perfectly down the midline, creating 2 equal mirror image halves. As you can see with this red plane, the median sagittal cut goes right down the center. It separates your right arm from your left, your right eye from your left eye, and this midline, this imaginary line, is going to be a super important reference point in just a moment. Okay, our third and final plane is the transverse plane. Now, unlike the other 2, this one's horizontal. It slices the body into a top half and a bottom half, kind of like the classic magician's trick where they saw a person in half. This gives us a superior or upper part and an inferior or lower part. And there it is, shown in green. This kind of cross-section gives us a totally different view of everything inside the body. So with these 3 planes, coronal, sagittal, and transverse, we can now pinpoint any location in 3 dimensions. We've built our map. Okay, so we've got our standard starting position, and we've got our map of planes. Now what do we need? We need a compass, we need directional words to describe where one body part is compared to another, all based on that anatomical position. Let's start with the easy ones, front and back. In anatomy, anterior means toward the front, and posterior means toward the back. So, for example, your nose is anterior to your ears. And on the flip side, your spine is posterior to your sternum, which is your breastbone. Nice and clear, right? Now let's do up and down.
Superior means toward the head, and inferior means toward the feet. It's that simple. It's our vertical axis. Your head is superior to your shoulders, and your knee is inferior to your hip. Hey, remember that median sagittal plane we talked about? That perfect center line? Well, here's where it comes in super handy. Medial means closer to that midline, and lateral means farther away from it. So your nose is medial to your eyes, and in that anatomical position, your thumb is lateral to your pinky finger. See how it all connects? Now for a couple of terms that can be a little tricky: proximal and distal. We mainly use these for our limbs, our arms and legs. Proximal means closer to where the limb attaches to the body's trunk, and distal means farther away from that attachment point. So your elbow is proximal to your wrist, but your fingers are distal to your wrist. Okay, here's another huge exam tip. Proximal and distal trip students up all the time. Here's the trick. Just remember that proximal is in close proximity to the trunk of the body. If you can remember that little connection, you'll keep them straight every single time. All right, deep breath. Let's put this all together. We have our standard position. We have our 3 planes slicing through the body. And we have our directional terms, our compass. Now we can combine all of them to describe any location in the body with absolute, perfect precision. Let's use the heart as an example. Instead of saying something vague like, oh, it's in the chest, we can now say with total certainty, the heart is superior to the diaphragm, it's anterior to the spine, and it's medial to the lungs. See, with just a few terms, we've completely pinpointed its exact location relative to everything around it. That's powerful. And this right here is why this language is so incredibly important. It's not just for passing a test. As this quote says, anatomy forms the basis for the practice of medicine. A surgeon absolutely relies on these exact terms to perform a life-saving operation. A physical therapist uses them to figure out your recovery plan. This language is fundamental to keeping us healthy. So, you now have the foundational grammar of the human body. You've got the map, you've got the compass, and you know the rules of the road. This language unlocks the ability to explore the most complex and amazing machine ever created. So the real question is, now that you can speak the language, what will you discover?